Am I at a greater risk for catching or getting COVID-19 since I'm pregnant?
During pregnancy, your immune system is slower to respond to germs, so there is a higher risk of getting sick from COVID-19.
Should I continue my prenatal visits? I'm worried about being exposed to COVID-19.
You should 100% still engage in prenatal care. It's actually really important so that we can make sure that mom and baby are doing well throughout the pregnancy. The way that we engage in prenatal care can change a little bit though. There's some visits that we absolutely need mom to come in the first trimester to do an exam and make sure that we've done all of the prenatal labs. In the second trimester, that's the fun one where we get an ultrasound and make sure that all the baby's organs are forming well. And we need to do some more labs again in the second and third trimester. So those appointments absolutely need to be in person.
What safety precautions should I take while I'm pregnant?
We want you to wear a mask if you have to go out. We want you to try to stay 6 feet away from people, so social distance. Wash your hands frequently, use hand sanitizer, and when washing our hands, it's important that we make sure that we're doing that for at least 20 seconds.
What are the risks to me and my baby if I get COVID-19 during my pregnancy?
So the data on what coronavirus does to the fetus in pregnancy is fairly limited. So moms who were in the first trimester who were infected in December are just now reaching the point where they're full term. So we don't have a lot of data. It appears that there's a higher risk of preterm birth, the baby being a little bit small, but in general, the risks don't seem exorbitant for moms who are infected in pregnancy.
Should I still have my baby shower?
Get creative with your baby shower. Consider a virtual baby shower, a drive-by baby shower, or holding your shower outdoors. If outdoors, continue to mask and social distance.
Should I be self-quarantining prior to delivery?
Not everybody is going to be able to stay home and shelter in place as effectively as other people, depending on what their personal situation is, such as their employment, childcare, other household help, and that. But it is in your best interest to attempt to stay in as much as possible. We usually say about 2 weeks before deliveries, so that's approximately 37 weeks, assuming that most folks will deliver around that 39-week mark.
Can I have my partner stay with me while I'm at the hospital?
As you begin preparing for the big day when you come in to deliver, one thing to be aware of is that there are limited visitors that you can have with you. So you may want to think about those support people who you want to be there with you, who can't be there physically, and figuring out virtual ways that they can be there to share the experience with you.
So what happens if I test positive for COVID-19 right before delivering my baby?
Your healthcare team will come up with an individual plan for you and your baby. We're there to support you to have the healthiest delivery possible.
If I'm positive for COVID-19 before delivery, does my baby also test positive?
At this point in time, there is not good evidence to indicate that there is a risk for vertical transmission. Vertical transmission is when the virus goes from mom to baby, either when the baby is still in the womb or at the time of the birth. At this point in time, the evidence would suggest that when babies do test positive for COVID-19, it is secondary to a postpartum exposure.
I'm worried about spending time in the hospital after delivery. Is it safe for my family to be there?
Your healthcare team is doing everything to keep you safe. They are screened daily, and we have a limited visitor policy. Ask your healthcare provider about the possibility of going home early if you would like.
Can I breastfeed if I start experiencing symptoms or if I test positive for COVID-19?
There are many benefits to breastfeeding that can affect your well-being, your baby's well-being. Breastfeeding is an important part of developing a new child's immunity. And even if you're having symptoms or you test positive for COVID-19, breast milk is going to be best for your baby. There are recommendations for expressing milk and giving to your baby. If you want to nurse your baby, we'll recommend masking and frequent hand washing in an effort to reduce exposure to your baby.
Should I quarantine my newborn from family and friends?
So when you go home from the hospital with your beautiful bundle of joy, everyone is going to want to come over and hold the baby and love on all of you. And the recommendation would be that that is at a minimum. more people leads to more exposures. And so if family members want to come and bring food, that's great. They should leave it on the porch and then maybe have a virtual encounter so that they can see your little one that way.
Will I have to wear a mask around my baby?
Any mom who tests positive for COVID and has a newborn, we would recommend wearing face masks because that's going to be your best layer of protection for keeping that little one from getting coronavirus. For household contacts, when there's no family members who are infected, that's an extra layer of precaution that's not really needed within your own household.
Should my baby wear a mask?
Your baby should not wear a mask. There's a risk of suffocation. Children under age 2 should not wear a mask.